Hello everyone, this is Teresa of Golden Years Advisors coming to you today to start talking about the 2020 Part D rodeo that we do every year. During this time period from October 15th to December 7th, you have an opportunity to explore your Medicare Part D. If you love your plan that you have, it will change some way, somehow. They all change a little bit. It might still be the best plan, but we always say it's worth looking at because there's changes that are made every single year. Your prescriptions change, and all these plans are very dependent upon formularies and pharmacies. So you want to make sure that you at least review what you've got to see if it's still the best plan for you. Also, during this time period, if you would like to leave Original Medicare and try out a Medicare Advantage, this would be the time that you would do that also. If you have a Medicare Advantage and you want to change to a different Medicare Advantage or go back to Original Medicare and get a supplement, you do that during January 1st to March 31st. During this time period, we are not going to review or talk about Medicare supplements. Medicare supplements can be changed year-round. There is no annual enrollment period or any special time of the year where you can do it. It is a month-to-month contract. Every year, all the numbers for the Medicare Part D change. This year, the deductible is $445. And many of you might realize that you don't ever use your deductible unless you're using non-preferred brand names. So usually generics, you don't have to meet your deductible, and preferred brand names, you don't have to meet your deductible. The initial coverage period goes from $0 to $4,130. Then you go into that coverage gap or donut hole, which really isn't like a donut hole anymore. You pay 25% of the cost of your brand name medications, which actually could be cheaper than what you were paying during your initial period. The catastrophic area actually doesn't start till you reach $6,550 of true out-of-pocket expenses. Remember, to get to the donut hole, it's the actual retail cost of the medication. To get out of the donut hole, it's your true out-of-pocket expenses. In the catastrophic area, you pay 5% or $3.70 for a generic, or you pay $9.20 for a brand name. All right, so there are some new things for Medicare this year. One that I think is a really big deal is they've taken the one knockout question for Medicare Advantage, and that was, are you on dialysis? If you're on dialysis, you were not able to get a Medicare Advantage. If you had a Medicare Advantage and started dialysis, you of course are going to keep you, but it was the only knockout question, and that question has been removed. So that's a big plus in the Medicare world for us. Another big thing that changed this year, many of you have a WellCare Medicare Part D plan, and there's 6 WellCare plans. They're the best priced ones. So a lot of you actually ended up getting those plans last year. And if you remember, Walgreens was not a preferred in-network pharmacy. This year, it is a preferred in-network pharmacy, and so is CVS. And they said all major grocery stores. So I don't know the definition of major grocery store is, but they made a big deal about it. Many of you might recall that last year was very difficult for us to do your searches for the best Medicare Part D plan. For years, we had this long digit number and a date, and we could pull up your old prescription list. And Medicare.gov removed that from their website, and it just broke a lot of things down. Everybody kind of went nuts. We couldn't prep for meetings, and you had to come in, and it just made our life much more difficult. So several different companies have done things to try to help improve this, and they've worked with Medicare, and they've made it so that some of these insurance companies and what we call FMOs and IMOs are able to actually access your MyMedicare in order to pull your prescriptions into these different search engines. So the company I work with is called Western Marketing. Many of you have seen me pull it up in the office, and they have a list of all the Medicare supplements available for your zip code with the pricing, and they actually show a lot more information than we would get, like say on the North County Department of Insurance website. They would actually tell you their rate history, how many people actually have this plan in the state or in the whole country. It's a lot of information. And what an FMO or IMO is, it's a field marketing office or an insurance marketing office. The insurance companies outsource the marketing of their health insurance plans, their Part D plans, etc. And so we have to contract through a marketing organization to get access to those different insurance companies. They've come up with something called a Medicare cart. And in this Medicare cart, we're actually able to access your prescription records. In order to access your prescription records, you have to have access to Medicare.gov, and they have a section called MyMedicare. And if you have a username and a password and have this all set up, somehow or another through voodoo and magic, there's a button we push, you give us access permission, and then Medicare will send your prescriptions through, the internet down to the Medicare card at Western Marketing, and then we're able to actually search all the different Medicare Part D plans for your zip code, and they'll tell us all the information we need to know. How much your medications are going to cost at different pharmacies, and be able to pick out the best plan for each one of you. We have not tested this yet. We don't have the Part D plans yet. They won't be available probably till like the middle of September to October 1st. So as soon as everything's ready, we'll practice on a few people. We'll practice on Jim, and we'll practice on my mom, and we'll try to figure out exactly how to do this. So when you're ready to make an appointment to do your Part D, you're gonna have to have access to MyMedicare. It'll be pretty simple and easy to do. And we'll give you instructions when you make your appointment on what you have to do, and we'll go from there. Well, thanks for watching. We're looking forward to seeing you all, whether it's in person or doing a Zoom call to do this Medicare rodeo that we do each year. It's so much fun. Last year I lost 10 pounds during the Medicare Part D rodeo, so maybe I'll lose some more weight this year. Get rid of that COVID-10. See you soon.